Okay, welcome back, everybody. So we will continue our contract concept discussion of the second one, which is on the toxicology support services. And I believe Dr. Georgia Roberts will give a presentation on the toxicology support services for NIHS. Dr. Roberts.
All right, thank you, and good afternoon, good morning, everyone. My name is Georgia Roberts, and today I'm going to present our contract concept for toxicology support for the Division of Translational Toxicology. Next slide. The DTT and its predecessor organizations have been utilizing contract support for toxicology research for over 40 years. The types of studies and frequency of use for various capabilities has certainly evolved during that time, and we anticipate to see continued growth to align with the DTT strategic portfolio. The key areas of support for toxicology research are highlighted here on the translational toxicology pipeline in yellow stars, and may include a focus ranging from general toxicology to developmental toxicology, immunotoxicity, cardiovascular toxicity, or others. Next slide, please. Here is a more detailed overview of the types of support DTT needs related to toxicology research, and I will go through each of these individually on subsequent slides. Next slide. The first type of support I'm going to review is the implementation of in-house capabilities. If you recall from the introduction by Dr. Stout, the distribution of intramural and research and development funding that DTT has is shown in the pie chart on this slide. Using the smaller proportion of intramural dollars, DTT has dedicated staff in our mechanistic toxicology branch that develop testing approaches and conduct studies at the bench. Using this mechanism of research, we are limited by funds as well as the number of available staff and facilities. So our goal described here is to utilize contract resources and research and development funding to implement and scale up technologies or testing approaches that have been developed in-house. This increases our capacity to perform larger studies or multiple studies at one time. Next slide. Our plan is to take well-established approaches that have been developed in-house and move them into the CRO environment. This is not to say that everything developed or performed by MTB staff would subsequently be implemented under contract. The focus would be on selected workflows, those that are both well-defined and for which we need additional capacity. Next slide, please. When you implement something developed in-house at a contract research organization, you can anticipate a period of iterative improvement as the reliability and reproducibility of a method are demonstrated in the new and more hands-off environment. After that, the goal would be to evaluate if a capability is ready for routine use and then to actually implement the testing approach or capability in an ongoing manner. This then frees up time for our in-house DTT staff to work on the development of other new capabilities, and again, increases our flexibility and capacity for those existing workflows. Next slide. As DTT implements new testing approaches, our longer-term goals would be to see broader adoption within the applied toxicology research community, and ultimately engagement with and use of newer data streams by our regulatory partners. Next slide. So moving on to problem formulation, we envision an opportunity here to better utilize our highly qualified and knowledgeable contract staff to support the development of research questions based on broad sets of objectives. We also anticipate support for analytical chemistry for both inhalation and non-inhalation studies. For inhalation studies, this would frequently be initiated with bulk chemical characterization and include the development and validation of exposure systems for both nose-only or whole-body exposure studies. For non-inhalation studies, the types of support may include confirmation of identity and purity of a test agent, as well as formulation preparation and analysis, particularly for longer duration studies. Next slide. In terms of study conduct, we anticipate an expansion of non-animal studies, including in chemico and in vitro studies. For in vitro studies, this may include simple or complex biological model systems, a number of which I have listed here on the slide. We also anticipate continued performance of in vivo animal studies, including various life stages from pregnant animals to juveniles and adults, as well as the capability to support multiple routes of exposure and the capacity to perform multiple studies at one time. We anticipate the need for broad coverage of both in-life and terminal assessments for whole animals or tissues. Next slide. So here I am reposting the charge that you are now familiar with, and we'll summarize that DTT seeks approval from the BSC to continue using contract support for toxicology research, and I'm happy to take any questions.
Okay, thank you. I have just a general question. I'm not exactly sure how this works. Of course, the NIEHS is well known to those of us in academia as a source of grants. I noticed on one of the areas that you had listed was microphysiological systems, which is kind of a newer area, state of the art, and a lot of the development for MPS systems are really being done in academic institutions. Are there contracts that go to the academic institutions, or is this all in private sector contracts?
So I would invite Dr. Stout to comment on this.
Thanks, Georgia. For a specific contract, there's nothing to say that an academic institution would not be eligible to bid on a contract. So the NIEHS develops requirements based on needs and puts out solicitations and with the idea of getting the best technical expertise to do the work.
Well, thank you. That's interesting. It is, I think MPS is an example of something where a lot of the development is really coming out, early development is coming out of academic institutions. It may be hard to find. There's a lot of commercial labs out there that are providing platforms, but in terms of the use and applications of it, I'm not sure. So thank you for that clarification. Any other general comments? We have Dr. Felter was assigned as a reviewer of this contract concept. So why don't we go ahead, not seeing any hands raised here, to Susan, and you can provide us your comments to start off the board discussion. Susan?
Okay, thanks, Dave. And Georgia, thanks for your presentation. I actually had a question, but I thought since I'm talking first, I'll roll it all in one. My question is around that first step of problem formulation, where it's not entirely clear to me what is being done in-house versus what you're looking at contract support to do, since is it problem formulation in terms of what research is going to help answer the questions that the DTT has established, the questions that you're trying to answer, or is the problem formulation around the questions we're trying to answer? Does that make sense?
It does. I think, part of the answer to your question is a little outside the scope of the meeting, but I think you captured it, all the possibilities well in terms of what that may look like. Okay.
Because I think the reason I'm asking is in the last many years, I've seen significant evolution of toxicology, and right along with it is NTP's and now DTT's evolution of approaches, and looking for newer methods that can help answer some of the questions that we couldn't have answered before when technology didn't exist, and try to develop questions that will allow us to really focus on human relevant questions. And so some of my questions are around, first I wanted to start with saying I'm fully supportive of the continued use of contract work for this. You guys have been doing it for decades. You're experts at it. It absolutely makes total sense to leverage what you can externally where that expertise lies. But my questions would be around the areas that are changing, where we have to think about things differently. And I'll give a couple of examples. One of them is the increased use of in vitro work. How much focus is being done to better understand the relationship between in vitro concentrations and an in vivo scenario using IVIVE? And is that being done in-house by DTT? Are you looking to contractors to lead that work? Because I think that that would be consistent with what I see as NTP's or DTT's goals of really increasing focus on human relevant testing. And we have so many new models being developed where it's really hard to know how to translate something in some kind of an in vitro system to in vivo. So that's an example of one of the questions.
Okay. So I think, that is certainly a focus of all of our testing approaches and research strategies right now. The specific approach in terms of how work is accomplished is really handled on a case-by-case basis based on individual, the circumstances for a specific program. But we do utilize all of the above, and it really does come down to a case-by-case basis.
Okay. So it's one, over the many years, I've had the pleasure of watching this evolution, and it's been very exciting to see as the science moves forward. And I know with animal testing, we went from just doing the testing, then over a period of years trying to understand what that means more for human exposures, and then maybe looking at how human exposures can help inform the testing, the doses that we should be studying in vivo. And I would say the same thing for in vitro models, to the extent historically, I'm not an expert in it. I'm not in the lab, but I sit next to people who are, and I know that they would just test up to concentrations that are cytotoxic. And so things are changing, and I would just encourage the DTT to, know that precedents are being set as these new methods are being developed. And you guys are at the forefront, very well-respected organization that does a lot of really important work. So I hope that there's an opportunity to really invest thinking into the protocols that we're using with these methods that are still under development, and how to try to translate those to a human relevant situation. Let me see if I had any other questions here. I think they were mostly around that. And then I guess another one that's kind of along the same line is with the newer methods, looking at things like RNA expression and omics analysis, thinking about what time points are going to be measured and what organs are going to be measured in. So that's all part of the protocol development, right? Is that being led in-house, or do you look to contractors who have expertise in that to help define that? Or how are you answering these questions in areas that none of us know all the answers, right? It's still evolving.
Yeah, so I think I'll just say, and it really does come down to a case-by-case basis, but I think for any of that, using that as a specific example, what we would likely do is sort of survey the available expertise and engage the right people given the question or the topic. And that is certainly done at the beginning of a research program. And those are all questions that we're continuing to ask ourselves and focus on.
So I see Dr. Berube has his hand raised. David, before I turn this over to you, I just wanted to follow up real quickly with a point that Susan was making, and I think it has to do with the issues of how the NTP and the DTT can facilitate through these contracts better correlations or better associations between in vitro concentrations and their relevance to in vivo studies. There are very few organizations in the world that have the capability of trying to address the in vitro to in vivo relationships in terms of dose. This is something the board has talked about in the past, and I don't know, how that fits in with these contracts per se. As you say, each one is individual, but I would just say that, I really encourage the more thinking about how do we make relevant in vitro concentrations in any of the toxicology studies that are done, whether they're under the toxicology support contract services or just within the NIEHS NTP DTT research programs.
Yeah, and can I just say one thing before we go to Dr. Berubey's question related to that? I think if I would refer you back to Dr. Stout's introduction with the slide about all the different types of support that we have. There's rarely a study that we conduct, I say study, but that's probably not even the right term, that we conduct that's really supported in isolation. In almost 99.9% of cases, we're utilizing expertise across a range of contracts as well as across our division and across NIEHS and external stakeholders as applicable. So the specific support that we get under individual contracts is decided sort of for each individual case, I guess.
Well, thank you for that. David Berubey, go ahead.
Yeah, I research expert heuristics and biases, and my question is basically, how do you determine what approach is preferred in a given instant in an effort to try to control an expert bias towards certain types of methods? Like what tools do you use?
So
I can keep going.
So I'll try and answer your question, and if I haven't quite captured, please follow up. So I think there maybe is not an unsupervised method that we use to address that, and a lot of the specific tools that we select on any given time are a compromise of several aspects. Obviously technical capability is always one of them, but we have to balance that with logistical considerations and funding opportunities. And so all of those things play a role when we're deciding to move forward with a specific study or project.
I mean, have you attempted at least to try to establish protocols on how this could be formalized? I mean, I've been just reading literature, and I'm writing a piece on this as well, that bringing in more voices does not necessarily solve the problem if all the voices have the same bias. And I've been studying in situation inhalation toxicology, where you have the installationists versus the more creative inhalation data folks who are doing things like producing animal boxes or actually whole units where an entire unit can be flooded with some sort of chemical in order to discern what the toxicological signature is. And what the research is beginning to surface is that it really depends on the bias that's in the folks who are looking at the data. In other words, if they've done a certain type of inhalation research most of their lives, they're biased towards that approach. And absent something that's a protocol, which is, real and something you can turn to and not have to go and reinvent the wheel every time you approach a different project. There's a susceptibility to producing more bias towards the data you're actually generating. So I guess my question comes down to protocols. Do you have protocols for this, or do you learn, we have a problem, so let's all sit together in a room and figure out how to solve it, or you turn to your protocols when you try to resolve the event?
It is both. So we have some testing approaches that we know how to do really well, but they are all flexible to accommodate customization that's appropriate for a given problem. And to your point, I mean, we try to always bring in a group of people that have disparate backgrounds. And I think across our division, even you have the opportunity to engage with scientific staff that do have different research backgrounds, and where applicable, and on almost all of our projects, we also engage with external stakeholders, both in terms of people that have expertise in the subject matter area as well as regulators. And so I hope that with that approach, we are addressing maybe one of your concerns.
I'm just like giving you the general forewarning that there's a lot of examples in history where people have done everything they could to avoid making a really bad decision by bringing a lot of voices together, and they still made a really bad decision. You know, I mean, it's tough to predict well, you can sort of predict some of the known unknowns, but you know, these unknown unknowns are really going to, you know, throw you for a loop. And I've been researching this climate change issue now for the last year and a half for another book. And I mean, here everybody thought they had everything nailed, and they did a really bad job, even though they were the top people in their field. And they brought in a lot of different groups of people to provide assessment, and they still did a pretty bad job.
Okay, well, I appreciate your comment, and we'll definitely take that into consideration.
Thanks.
Those are certainly challenging things. Anytime you have an issue where expert judgment is involved, that means that individual biases enter into the decision. And I appreciate Dr. Berube comment about, you know, bringing more voices doesn't necessarily solve the problem if those voices all come from the same perspective, and how you deal with that is a challenge. I think you provided a good answer to that. Any other comments or questions from the board for Dr. Roberts on this concept?
Well, Dave, maybe I can just say that I think that there's some link between the point that Dr. Berube was just making and the question that I had around protocols, because we have such a long history of having protocols defined that once a precedent has been set or a regulatory guideline has been published, it can be very difficult to move away from that, even though the science has advanced and taught us new things around nonlinearities and kinetics and saturation and things that we as scientists would like to see us utilizing now and defining our protocols. But sometimes it's almost like hands are tied if a guideline doesn't allow for that. And so to the extent that the DTT can look for ways, you know, you guys have really focused on how do we take on these really challenging questions around what's relevant to human safety, and find a way to be able to do that key research that might involve having deviations from protocols that have been used for generations, decades anyway, to focus more on, okay, so we always did it that way before, but here's our scientific question, and what's the best way scientifically to go about answering it. Might involve challenging some status quos that, you know, if you get 20 people in a room, 19 might just, you know, reissue that status quo. So I think that there's a link there to what we were hearing. That's really all. I guess, David, did you raise your hand again?
The only thing I want to just add is that the reason, I mean, I think resilience is what needs to be generated, and the best way to get resilience is probably using a system which has both the use of foundational protocols and very creative approaches towards the issue. The reason I think protocols become important is because of the transparency issue. You know, if you really want to get transparency, you've really got to let everyone know up front how they're going to be evaluated. I consult with a lot of industries, and you know, this is a fundamental problem they confront regularly. Is you know, if they want to be transparent, they have to have protocols, and if they want to have protocols, it makes them less resilient at times. And there's trade-offs in all of this, which is why building protocols is such an awful job.
Yeah, and the way that I like to communicate that internally when we're developing a project is there are key elements that I would say are closest to what we have right now as a outline or a protocol. But the way that I like to think about it is that there's a buffet of lots of different ways that we know how to enhance the use of animals in our studies, if you're talking about an animal study in particular. And using the buffet options, you can really tailor a specific approach to address the needs of a study while still retaining the efficiencies of things that we do know how to do well. And so I think that's kind of the approach that we take for specific projects.
Yeah, I've used that metaphor a lot.
All right, thank you. Any other questions or comments from the board for Dr. Roberts? If not, we will move to call for a vote here, and I need a motion initially. Susan, can you provide us with the motion?
Yeah, I move to accept the continued use of these contracts.
Do I have a second?
Sure, second.
Ruby seconds. So the motion is on the screen, as you see, made by Dr. Felter to approve the contract concept for toxicology support services for the NIEHS. Dr. Berubia seconded it, so that is a yes vote. Dr. Bloom?
Yes.
Dr. Felter has made the motion, so that's approved. Dr. Michaels? Dr. Michaels, are you still with us? He may have had to step away.
Sorry, yes, I am, but I'm muted. Yes, my vote's yes.
Thank you. Dr. Payne Sturgis?
Yes.
Thank you. Dr. Rusi?
Yes.
Dr. Ryan?
Yes.
And Vina, are you with us? Are you back now? She's apparently still away, so we will have her with no vote at this point.
I think she's
So-
1 minute away from being back. Sorry about that.
Pardon me?
I think she's 1 minute away from being back.
Okay,
That's-
okay.
Mhm.
So we will, as it stands now, there is unanimous approval for this motion, and so this will be passed by the board. Okay? All right, well, thank you. Now we will move into the third and last contract concept to be reviewed today by the board. And this is the contract concept for pathology support services for the NIEHS, which is obviously, given the amount of in vivo studies that have gone on historically at NTP and continue, this is a critical service. And Ms. Donica Andrews is going to walk us through the contract concept review for the pathology support. Donica?
You are on mute.
Sorry about that. Yes, hi, my name is Danica Andrews, and I'm going to be presenting the contract concept review for the pathology support for DTT. Next slide, please. So the overall purpose of these contracts is to provide a variety of pathology support for NIEHS, and that's both DTT and DIR in everybody's research programs. Next slide, please. So just what I'm going to go over today is the brief background, and then go over some of the functional services that these contracts provide for us. Next slide, please. So the pathology support contracts have been in place similar to chemistry and pathology and toxicology for the past 40 years. They initially were set up to provide peer review services for DNTP studies. And over the years, they have evolved to support DIR studies as well. So currently we do support the DTT and the DIR and other federal agencies with their pathology needs as they come to us with projects. In addition, over the years, we have incorporated and increased newer technologies such as digital imaging and molecular pathology techniques. And of course, all the professional and technical services and expertise that we need to support all of these services. Next slide, please. So one of the foundational parts of these contracts was to support pathology peer review. So we've both done primary pathology evaluations and these peer review for the DNTP studies and now DTT studies. And to do this, we do need a wide range of organ systems expertise to be able to review the wide range of projects that come through our program. Next slide, please. One of the other functional services that we provide is necropsy and histology. So we have necropsy and histology support for, again, both DTT and our DIR labs. We can provide immunohistochemistry, immunofluorescence. We do in situ hybridization. We can do frozen sections and electron microscopy. Next slide, please. One of the things that's different about the pathology contracts from the others you've heard about is personnel support is a really fundamental part of our contracts. And we get both professional and technical support for lots of our groups and core laboratories. And so this includes both pathologists for helping us conduct our DTT studies. We also procure some technicians and specialists and additional pathologists to work in the core laboratories and help us with all of these other groups that you see listed here for different pathological services and core facilities. In addition, we do have some on-site veterinary and technical assistants to help with our laboratory animal medicine group. And our molecular pathogenesis group, we utilize bioinformatics and omics and for in vitro culture system support as well. Next slide, please. So over the years, we have expanded our functional services to include a lot more imaging sciences. And lately we've gotten into a lot more artificial intelligence, more image analysis. The past few years have really brought more telepathology to our group. In addition, we now have the capability for doing these whole slide scanning of our slides from the studies. And we can also do a lot of specialized techniques such as MRI and CT scans. Next slide, please. In addition, some of our other functional services include investigative and mechanistic study support. So we can provide in vitro culture systems, in vivo studies, molecular biology techniques, and of course the associated bioinformatics support needed to support all of the data that come out of these particular studies. Next slide, please. And one other thing that our contracts help us with is scientific publications. So not just scientific manuscripts, but we also utilize the expertise from these contracts to help us create the non-neoplastic lesion atlas, which is a public available database used worldwide. We also have an electron microscopy or ultrastructural atlas that is publicly available. And currently we are working and we'll continue expanding a global toxicologic pathology training program, which is going to provide lots of detailed information for trainees and even existing pathologists to review state-of-the-art information. Next slide, please. And so, of course, over the years, there have been a lot of emerging technologies and new needs that our group has had to expand into. Some of these are increasing those mechanistic studies. Of course, very recently, we were involved in some COVID studies to help with emerging public health issues and getting some information back to our partners on those. And we've also been, there's a need for increasing some new capabilities to modernize the laboratory animal medicine practices. And so some of those projects that we're getting into now are physiological monitoring, which we're very excited about working and getting more involved in that, in vivo imaging and behavioral assessments. And then, of course, we all know there's a great increasing need to be able to translate all of this data from animals to humans and from in vitro to in vivo. And so we are working and expanding those capabilities as well. Next slide, please. So the basic charge to the board, we hope to seek your approval to continue this type of these types of activities in a contract mechanism for pathology services. And with that, I'll thank you for your time, and I'm happy to take any questions that you may have.
Thank you, Danica. This is obviously a very important support for the NTP. I had a sort of a general question. I was surprised perhaps a little bit when you had mentioned some in vitro support. You typically don't think about pathology, pathological services as being for in vitro. But I came across the other day a platform in which they were using 384 well formats for imaging of Ames assays, in which you would have a high throughput mutagenesis screening, and it's all done by computer imaging of the 384 well. Is that the kind of service that might be that would fall under this contract, or would that something like that be under a different one? Because
So we're happy to support anything like that as well. I think more of the stuff we're thinking is, organs on a chip and things like that, where we really can see more functionally what's happening. But, we're open to being able to incorporate and investigate all of these things and provide support for them.
That's interesting.
This is Matt.
So,
I'll just add that an
Dr.
example.
Ryan?
Oh, excuse me.
Go ahead.
I'll just add one example. So there's an air liquid interface system, for example, that we're able to generate histopathological slides of the cells in the well and look at those. And so that may be one example of a use case for pathology in an in vitro environment.
Got it. Got it. Very interesting. Okay. So Dr. Ryan has been tasked as well with reviewing this concept. And so, Anne, I will turn this over to you and encourage once you're done for the other board members to come in with questions if they have them. Go ahead, Anne.
Sure. Well, like Susan, I saved my questions till it was my turn to talk. So Danica, could you help me understand, is this contract, is it a 5-year since the last review, or is this a change in the statement of work because of new capabilities?
So this is a recompete, and it's been 10 years since the last iteration.
Okay. And after my previous question, I wasn't sure if I can ask what those new capabilities are, the recompete. Is it the expansion in the digital imaging and the specialized technology, this global tox training program, which in the blurb was identified as new? So just
we have already begun work in all of these areas. We're just going to continue to put more emphasis on them as we move forward.
Okay. And then the other question I had, so your presentation or your write-up was the only one that really specifically spoke to the DIR support, the intramural research. And so I was wondering if you could elaborate on that a little bit. I was kind of confused by Dr. Stout's slides. So you guys that work within the institution, you're familiar with all these funding mechanisms and contracts. Those of us that are on the outside, it's a little confusing. So is this pathology contract support that DIR, or is it more of a collaborative where you exchange capabilities and co-authorship on publications? How does that work, or it depends?
I'd say it depends.
Okay.
We have both sides. We initially, like I said, we started these contracts to support the at that time DNTP research, but we also have many core laboratories that need pathology support. So we have brought a lot of personnel to help us with these. I'll let Dr. Sills speak to this a little further, since he's been involved in those a little more than me over the years.
Okay.
Hi, Anne. I'm good to see you. So we provide pathology expertise to the Division of the Translational Toxicology and the Division of Intramural Research. The Division of Intramural Research is more PI based. So we provide most of our core lab expertise, such as imaging sciences, histology, EM, laser capture microdissection, mouse embryo phenotyping. So we provide that expertise to our DIR colleagues. And so it's a service. I don't like to call it a service because it's really an expertise. And so that's where, when we think about DIR versus DNTP, and if you think about the pathology support contracts, we also use them for the technical expertise. So we have federal employees plus contract employees that are in the laboratory to support the needs of the DNTP and the DIR.
Thank you.
So I see a couple others of DTT staff. Mark Sesta, would you like to add to that?
Yes, thank you. Hi, Mark Sesta. I'm a DTT pathologist and head of the pathology evaluation and peer review group. And we do provide pathology. We do read slides for DIR scientists, and we'll read their study for them, and we offer that on a collaborative basis. And we do use the contracts for that sometimes as well. So I just want to add that.
Well, thank you for that clarification. Matt, did you want to add something further?
Yes, I'll just add that across our contract portfolio, and I certainly agree and apologize that it's confusing. It certainly is, even sometimes when you're in-house. But across our contract portfolio, any or all of our contracts may support contracted activities may support DIR, either collaborations or projects, as well as we collaborate internally in many cases, and that could range from formal, where there's funding for both divisions on the contracts, or where we utilize our resources on projects that are of mutual benefit or benefit to public health. So it depends on the case, but there are a number of mechanisms. As I mentioned earlier, the contracts are NIEHS contracts, so there's no barrier to to supporting other divisions. I would say in the case of pathology is as Danica and Dr. Sills and Sesta mentioned, it may be a little more routine, but it certainly exists across our contract portfolio.
Okay, great. Thank you.
Eric, Dr. Bloom, you have a comment? Eric, I think you're on mute.
Yeah. So I had a question actually related to, I mean, the other area that has changed is digital pathology, but beyond digitization, i.e. scanning slides, does this contract has in scope seeking the expertise or necessary resources to develop like artificial intelligence, machine learning type of algorithm to actually maybe address evaluation of slides in a more routine manner or things like that? Or is that part of another contract?
So that is part of this contract. Yes, I don't know how much into detail I can get on this without in the open session. But yeah, definitely AI is something that we are expanding into with the possibility of all the things that you've mentioned.
Okay.
So Ron could provide some general comments, some very general comments, which will be helpful.
Hi, I'm Ron Herbert. I'm a pathologist in DTT. I'm the group leader for the CMPP core laboratories. One of the things that we're currently doing is developing the capability to do artificial intelligence within the core laboratories. We have just established an imaging sciences core laboratory, which is comprised of digital imaging, image analysis, and now artificial intelligence. We have been able to get expertise and professional expertise on site here at NIHS by using the contract mechanism, and we have acquired the services of a artificial intelligence scientist to help us develop the capabilities of artificial intelligence at NIHS in our core laboratories. We hope to, in the future, expand that into these pathology support contracts so that they can support the work that we're doing for both the DTT and DIR. A lot of the work right now is going to be primarily diagnostics, but we hope in the future that a lot of the AI applications are now going to be research oriented. So we're still in the process of developing our AI capabilities for DIR and also for DTT.
Thank you for that expansion. That's very helpful. Any other questions or comments from the board?
This is Devin. I had a couple of questions. Is that okay? Yeah.
Yeah.
Go ahead, Devin.
Great. Thank you all for the presentations thus far. I just had a couple of questions just to clarify when I was looking back at the description for this scope. There was mention of using the contract support for publications, and it listed like several, examples. And I was just curious, is this something that has been part of the contract scope over these last through your existing contract? And curious about how is attribution then given with regards to these publications?
Yeah, so they've definitely been a part of the contracts for the past several iterations. And I personally don't know too much about the attributions. I know that these are DTT or DNTP products. I think Mark Sesta, having been on the non-neoplastic lesion atlas, could speak to how attributions were done for that. But yeah, sorry, I don't know those details well.
Go ahead, Matt.
Thank you. I'll just say again, across our contract portfolio, there are a number of examples of publications that may include a mixture of contract and government staff. And there is certainly, not only either authorship or affiliation. We also have a mechanism under our US government reports of, and this uses PubMed acceptable language of having groups of collaborators and contributors. So there's acknowledgement across the scope, from a major collaborator all the way down to somebody that, does a lot of the work sort of in the background. But that is something that's of high importance to us, is that there is appropriate acknowledgement of, contracted and government efforts. And so that's reflected in our a variety of our different publications.
Yeah, and I could just add a little bit to that. So Danica mentioned our non-neoplastic lesion atlas, and that's publicly available. And so for each section, for example, there's a section on the respiratory system, the digestive system, and at the end of the section, all the authors are acknowledged. So we really, like Matt said, we acknowledge everyone who's contributed to these scientific publications.
Excellent. I had just one other question, and I noticed that there was a description of a new undertaking. You were saying that under this new contract mechanism, you wanted to look at a global toxicologic pathology training program. And I was just wondering, is there a model that you had in mind that you were looking at to inform how that would be implemented? And in terms of the trainees, is this something where it's NIEHS staff overseeing these trainees, or how is that going to work?
So I could help with that. So we have a training program that's established in laboratory animal medicine, toxicologic pathology, clinical pathology, and molecular pathology. And those are we have trainees who are on site at NIHS, and those are well established, well recognized. So what we're doing now, we're establishing a global toxicologic pathology training program website. So it's a website, and so we've had enormous successes with the non-neoplastic lesion atlas. And so, like we've been talking today, it's great that we can make all the information public. So we're developing modules where anybody across the world could learn about all our experiences. So they're training modules, and we're very excited about this.
I see. Okay, thank you for that clarification.
And we can, and since if you're interested, we'll send out to the board a link, and you can go and see the website that's been put up. It's just been launched over 2022, and obviously we'll have opportunity for adding more. So we're happy to share that with you. Thank you for asking.
Thank you. Well, that is a very interesting opportunity, especially if that's global and online, available online. I think that's a great service you guys would be providing. Any other comments from the board on this contract concept for pathology support services, which obviously covers a very large ground of lots of different ideas? Okay, not seeing any more input from the board, I would call for a motion.
Yeah, so this is Anne. So I will move that we accept the pathology contract concept as reviewed and discussed today for approval.
All right, thank you, Anne. Do I have a second?
Sure, David.
You're consistent, David.
I am. What is it?
Okay, well, thank you. So we will go through, again, we are voting on approval of the contract concept for pathology support services for the NIHS. Dr. Berube has seconded it, so that's his yes vote. Dr. Bloom,
Yes.
Dr. Felter,
Yes,
Dr. Michael stepped away. Are you back?
No, I'm back.
You're
Sorry.
back, thank you.
Yes, I say yes.
Okay, great. Dr. Payne Sturgis,
Yes.
Dr. Rusi,
Yes.
thank you, Mark, and Anne made the motion. And Vina, are you back now?
I am, and I vote yes.
Okay, thank you. And Vina, just you missed two of the earlier votes, and but I think you heard some of the discussion, at least for the first one. If you want to cast your vote in favor of those, you can do so now, just by just letting us know.
Yes, I would like to vote yes for those.
Okay, thank you. Okay, so we now have unanimous votes for approval for the contract concept for pathology support services. And that is the last of the presentations today. I would say these are obviously very important contracts. They get at the heart of what the NTP and DTT is all about. And I have to say, I was quite impressed with how it appears, without being able to get into the nitty-gritty of these contracts, of how they are really collaborative opportunities outside of the walls of the NTP and the NIHS, which I think is great, to be able to go out and seek the best expertise and from a variety of different organizations, groups, vendors out there that can provide the very best. And I think we had some good discussion here, and I'm happy to see that there was unanimous approval of all three of these concepts, because they are at the heart of what NTP, DTT, and NIHS do. Dr. Berridge had to step away, and he was going to make some closing remarks, but he indicated to me that if he was not back, he had to go to another short presentation, that Michelle, Dr. Huth, was going to provide some closing remarks. Michelle, are you prepared to do that?
I am, thank you. And it's really my pleasure to be able to thank all of you, starting with each of the board members, for your thoughtful considerations that you offer for us to think about incorporating into our deliberations, and for taking the time out of your busy schedules, particularly this time of year. And thank you, Dr. Eaton, for your leadership in chairing this meeting. I also want to thank all of the presenters, Matt and Saramia, Georgia, and Danica, and also all of the other DTT cores that provided support throughout this process as we were preparing to share this information. Also to our colleagues in the Office of Acquisitions, Julie Bardo and Melissa Gentry, who are our partners throughout this acquisition and contracting process. Mary Wolf and Melanie Brownlow for all of the meeting preparations and implementing this review, which is so critical, as you all recognize, to how we get our science done here in DTT. And I also want to thank Nathan and John and Jason and others for always the expert care in helping us navigate the technological issues. And so I wish you all happy holidays and hope it's restful and relaxing and healthy. And thank you again to the board members that are rotating off of the board. It's been a very active and really productive, meaningful engagements with you, and we look forward to engaging again in 2023.
Well, thank you, Michelle. Dr. Brownlow, do you have any final announcements that need to be made?
So if I
do, but if I may, I'll let Mary go first.
Oh, that's fine. I just wanted to take a moment to echo the comments that Michelle made with regard to not only the thanks to the staff. It really takes a team, and everyone works together so well to help us pull these meetings together. And obviously, then we appreciate all the hard effort of the board members and those of you who are rotating off. We've certainly enjoyed working with you. Please know that our activities continue, so I'm sure we'll be calling on you again to participate in other types of NTP related activities, workshops, other types of panel meetings and things like that. So don't think that you're off. And to others, to the remaining board members, we certainly look forward to your continued engagement in 2023, and we will be bringing on some additional members to not replace, but to add to the wonderful input that we've received from the retiring members. And I also have to certainly thank Dr. Eaton for his close collaboration with us and the planning of these meetings. Having a chair that is very responsive and is so well organized always makes it such a pleasure to execute. So again, we hope everyone has a safe holiday, and we look forward to good things in 2023. Thank you. Eleni?
Yes, thank you, Mary. So I would like to echo everybody's gratitude, appreciation for your contributions, for your participation. I want to thank everybody for the preparation for today's meeting. I want to especially thank the board members for their patience and flexibility as we were planning and organizing schedule and meeting agenda. So thank you again. And also to thank everybody that has helped put this meeting together. So I know they've been mentioned and named. I won't repeat everybody's name, but please know that you've contributed. If you have contributed in any big or small part, you're very much appreciated. So as a reminder, today's slides will be made available on the public website as soon as they meet government requirements for accessibility. And in agreement with what I mentioned in the opening, the minutes will also be posted on the website once they have been reviewed by the board members and approved by the chair. So thank you, everybody, and I will give it back to our chair.
Well, thank you all, and thank you to all of the NTP and IHS staff for making these meetings well organized and very streamlined. This is my last meeting as chair. It's probably not my last meeting attending the BSC, so I will see you all again next year. I wish everybody happy holidays and safe travels if you were out and about. And with that, we are adjourned. Thank you all. Take care.